In this video, I'm going to take you through 5 exercises that you can do at home if you have lateral hip pain. So if you have muscular soft tissue pain on the outside of your hip, one of the best things that you can do is to get it stronger. I'm going to take you through 5 exercises today, starting right now. The first 2 exercises I am going to show you are going to be isometric exercises. Now this basically means you're contracting the muscle but without any movement going on at the muscle. Now it's one of the least aggravating exercises that we can give you for lateral hip pain. So I'm going to show you the 2 isometrics first, as they're likely to aggravate your symptoms least, and then we're going to move on to some movements through range and maybe even with some load. So first exercise, I'm going to show you square on against this step, but you can do it side on against a wall. But just so that you can see me, you're going to push, you're going to do this movement, and you're going to push against something solid that is not going to move. And the theory is this is going to contract your glute muscles without any movement going on. So you're just going to put your weight onto the unaffected leg and then push in that direction and hold. And this is one way that you can progress this exercise with the length of hold. So you might want to start off with 5 seconds, and then you can increase that to 10, 15, 20, etc. The next isometric exercise I'm going to show you will require a belt. So you're going to pop the belt around your legs like so. And you'll basically, if I show you without first, you're going to push in this direction again. So you're going to push out to the side into the belt and hold for a few seconds. The same principle as before, but you're not going to see any movement going on when I do this because there's going to be resistance. So you're basically going to push out to the side. So get some tension on that belt, hold for 5, 4, 3, 2, 1, and then relax off. Push, hold for 5, 4, 3, 2, 1, and then relax. So not a very irritable exercise, should just feel like a little bit of strain around the sore hip, and then you can progress with time. Do not use a resistance band for this exercise. Don't use something elastic, it will stretch, and then you'll end up doing the exercise through range. So you want something nice and rigid that's not going to move. Now we are going to complete some exercise through range. First exercise is going to be a bridge. So you're going to have feet sort of hip width apart, a bend in the knee, hands on the floor, and then you're just going to push up, hold for a second or 2, and then slowly down. Push up, hold for a second or 2, and then slowly down. Now, with these exercises through range, ideally we're aiming for around 3 lots of 10. So you're going to do 10, have a 30-second rest, another 10, 30-second rest, followed by another 10. If you got to number 10 and you found that you could do quite a few more and that doing it on 2 legs was quite easy, the progression would be to do it on 1 leg. And all you're going to do, if the right hip is the one you're trying to work on, keep that one on the floor, lift the other leg up, and you're going to push through the one side. So I'd strongly suggest not moving onto a single leg until you can do your 3 lots of 10 really well with good control on your 2 legs. The next exercise is going to be hip abduction on your side. So make sure you're comfortable. I would bend the bottom knee so you've got some stability and you can put your hand on the floor. You're going to keep your top leg straight and you're going to lift it up off the other one and slowly down. So this is the one that you're working. And things that people typically do wrong. Number 1 would be pointing the toes up to the sky. Don't do that. Make sure they stay facing forwards. Second thing would be bringing the leg too far forwards. You're going to start working on your hip flexors as opposed to your glutes. So make sure that leg stays in line with the trunk. And then the last thing is either having the hips too far forwards or too far back. You want to draw an imaginary line through the bony prominence on the outside of the top hip, straight down, so that it's over the top of the bony prominence on the bottom hip. So you want everything nice and straight. If you did find that too easy, the progression would be to grab a resistance band. You're going to pop that around your ankles, back on your side, and then that extra bit of resistance is going to make things feel slightly more difficult. Exercise number 5 is going to be a sit to stand, or if you're in the gym, you could do it on a bench, but you're basically going to do a squat type movement. So you're aiming for your bottom to touch the chair and back up. So feet sort of hip width apart, toes facing forwards, knees stay behind your toes. So if you look down, you should be able to see your toes. You want to avoid your knees disappearing over the top of your toes. So the cues are, stick your bottom out. Imagine you're going to sit down in the chair, and this is going to be your sit to stand. Same principle, 3 lots of 10. But if you were to get to number 10 and you found that quite easy, then all you need to do is keep the movement the same and add some load. So you would grab some weight, pop it across your chest, and then you're going to do exactly the same movement. Bottom out, touch the chair, and back up. Now, when you're doing any exercise for any musculoskeletal problem, it's really important that you appreciate there is a spectrum of severity when it comes to symptoms, and the exercise that you try, or actually even whether exercise is appropriate or not, really depends on where you are on that spectrum of severity. So I treat people every day that have lateral hip pain, and some of them have very irritable symptoms and they're at the not so good end of the spectrum. Sometimes they struggle to weight bear, they can't lie on their side, even walking any distance is really sore and uncomfortable. And I see people at the complete other end of the spectrum, the better end of the spectrum, and they only get some lateral hip pain after they've run 10 kilometers, for example. So it's important to appreciate that when you are searching for exercise online, they're generic, they're general, they're not bespoke and personalized to your needs. So if there is anything within these ones that we've tried that you'll find a bit too sore, a bit too uncomfortable, don't do them. It's really important that you listen to your symptoms, and it's your symptoms that will dictate what exercises are and what exercises are not appropriate to do. So I really hope you found that video helpful, and it does go some way in improving your lateral hip pain. If you would like some more free help, then there is a completely free hip pain guidebook in the description below the video. If you'd like to know the difference between lateral hip pain and osteoarthritis of the hip, there's a video on the YouTube channel that you can find. And if you want more bespoke, personalised help, because you are struggling to manage your symptoms by yourself, then I do offer a very few limited number of private appointments, both online and face-to-face every single week. You can find details about that in the description below the video as well. And if you have found it helpful, please do like the video and subscribe to the channel so you don't miss anything. It means you'll get notified every time I release new content. It also means more people will see the content that you have found helpful. So thanks very much. And whilst you're doing all of those lovely things, I'll see you in the next one.